in this very building, and at that point I had short hair, so you know that it's been going on a while. And at that point I came along on my own with colleagues from both trusts and our commissioners, and we put in the bid to become an early adopter. I'm really pleased to be successful, and I've brought today my team that we've pulled together ever since then. So everybody will introduce themselves as they go. So Somerset is a fairly large county in the southwest of England, for those of you that don't know it, and actually we are one LMS. The LMS is the county, as is the STP. We've got two acute providers, one at Yeovil, down in the bottom, sort of southeast of the county, and Taunton further to the middle, but still quite south of the county, so there's a lot of the county north of us. So two providers and one CCG, so a very small LMS, but one that's grown a significant amount in the last 2 years. So, as I said, 2 years ago our journey began, and at that point we set out a vision for Somerset which was unimpeded by organisational and professional boundaries. At that point the two heads of midwifery worked quite closely together, but there was no other real links across our trusts. And obviously we're very excited to see the Better Births report come out, and the opportunity to get an early head start on that work, and the extra support that we could get through being an early adopter. So specifically we decided to focus on improving postnatal care and perinatal mental health and digital transformation. The aim being that we would achieve this through developing new roles and models of care, which you'll hear about, and improving continuity with a focus on the most vulnerable women in our services. And we have got some quite high areas of deprivation. And all of this underpinned by enhanced digital technology, which all sounds very grand, but it's been a long, long journey. So why did we choose those two elements? Because obviously there were the 7 elements at the time, but the early adopters were sort of asked to say what they wanted to focus on. We chose postnatal care because very much it was the Cinderella part of our service. Care had gradually over the preceding years got more and more fragmented, unable to do home visits anymore. They kind of completely disappeared, as I'm sure they have in many services, as well as we developed drop-in sessions, so women would see different midwives every time they came to clinic. And we had no specialist service provision for women with perinatal mental health at that time, so we felt we needed to put an extra layer of support in for them as well. Obviously, we felt it was very important to focus on that transition to parenthood because it had those long-term health outcome implications. And as far as digital was concerned, we both very much had paper-based systems, and we were we are in the 21st century, but sometimes it feels as though we're still way back in the sort of 1980s, 1990s, doesn't it? So our ambition was to develop a mobile, flexible workforce, digitally connected with friendly, user-friendly, app-based technology, which Paige is going to tell you all that. So that's it from me, and that's over to Paige. The team.
My name's Sally Brown. I'm a maternity matron at one of the trusts at Musgrove. I started this early adopter project as one of the traditional lead midwives with my colleague Paige. At the start of our digital transformation, we were, as Helen said, an incredibly heavy paper-based service across both sites. We had many different systems, none of them spoke to each other, lots of confusion for staff and lots of confusion for women. And what we were very keen to do at the start of the project was find out, one, what did our staff want from this digital transformation, but more importantly, what did our women want, and what were their expectations, what were their assumptions about what we already had. And that was really quite interesting for us. We heard a lot of things that we hadn't actually thought of. So we spent a lot of time at the beginning of our project scoping, mapping, having a look at what we had, and asking people what did they want us to do. So we invested a lot of time and energy in getting out there. We spoke to as many different staff groups as we could, not just the midwives and support workers, the obstetricians. We went to speak to GPs, we went to the GP IT leads and spoke to GP practices, asked what they wanted, what information would they like from us, what were they currently getting. We did lots of scoping to see what that communication looked like. And then we did lots and lots of work with the women. We sent out survey entries via our social media platforms, and we actually invited quite a lot of women to come in to see us, to have one-to-one interviews, to really talk about what information they wanted from us, what information they wanted around their pregnancy, and what they expected from us, how they expected us to understand about about them and what they thought we already knew, which of course was not a lot because they forgot their notes. So it was really informative for us. So we started this vision of where we were, what that looked like, how confusing that was for everybody, and where we wanted to be, which is have everything in that easy, accessible, one place where everybody, all professionals and the women can have access to.
So I'm Paige, I'm the digital lead midwife for Somerset. It's been quite a roller coaster of a year for digital. We'd love everything to be easy. We've had lots of challenges, but there have been plenty of achievements along the way. So in terms of developing our single electronic access for our patients and having that one singular record, it's almost felt like a couple of different work streams going on. So first work stream has really been focusing on utilising what we've got in now, which is in the live system. So training the midwives on the shop floor to use it better and having that kind of change of culture in understanding that actually an electronic record, is still your record of care, even if it's not on paper, it's written down somewhere. So it's changing that mindset that actually it's the same being digitalised than it is on paper. So working with midwives on the shop floor, giving one-to-one training so they can really get to understand the system they'll be using going forward into a paper-like service. The second sort of work stream is actually developing the live system, so having it interoperable with all these different systems, so having the scans in there, all of our blood results, so that you're not logging into several different systems to get that patient record. That's been one of the biggest challenges for us at the moment. We've got a fantastic digital team and we are a global digital exemplar site. As much as I love to champion maternity and really push our agenda, we've had to filter into the wider trust digital agenda. So fitting into their project management and timescales has been a bit tricky, and that work for developing all of that interoperability is all planned for January, so hopefully throughout the next year we'll be in a position to start setting dates to start taking away the paper, so that's really exciting that work's going on. We're also in negotiations with having that record across the whole of Somerset at the moment, so that actually women can turn up to whatever service provider they want and have that record seen by their healthcare provider. So it's really exciting. We've also been working on our digital information signposting. I say that digital has been a bit of a roller coaster. This has kind of been the loops in that. So going back and forth with apps and websites and deciding what's right for our service, we've decided to use progressive web app-based technology. So really utilising our trust websites and keeping them up to date, so actually women can still log on their phone as if it's an app, but it just opens the website in live, so that information's up to date. And that's also got our single point of access built into it, so really exciting work going on there. And then having that digitally connected workforce. All of our midwives now have laptops out in the community, so they can connect back centrally, so they can open the patient record, they can access blood results, they can Skype, it's much better for communication. And one of the biggest challenges has been about connectivity there. So having free Wi-Fi in GP surgeries has been absolutely brilliant, and like we say, we did ask the GP leads and they're all willing to have our system on their services so that actually we can access that record. So yeah, I think this year going forward, it's going to be a massive period of change for digital. It feels like we're kind of snowballing now and it's going to avalanche into the next year or so. That's digital.
Hello, I'm Liz and I'm the practice development midwife for the Early Adopter Project. I'm not going to say an awful lot, you'll be relieved if you've seen me at other conferences. I talk a lot. The decision today was that and some of you will have seen this, but we have a video clip that really encompasses the whole story of what we were about. For us, the postnatal and perinatal mental health was the focus of our project, and to be able to improve postnatal care and support perinatal mental health in a better way, we made the decision we needed another layer of professionals in our workforce. That layer is our development of maternity support workers. They are a fantastic resource available to us. We started back on the left-hand corner, top picture there, we started with level 3 apprentices 4 years ago now, and by utilising the level 3 apprentices, that has enabled us to release a little bit of funds and develop our band 3, some of our band 3 support workers to become band 4s. So they are currently travelling on that journey, and they are our additional layer to have band 4 support workers both in the community and on the postnatal ward. And they are already making a massive difference. For us, it was about focusing on continuity of carer and really, as I say, making that difference for our families out there. And this particular couple on the video. As I said, some of you will have seen this video, but the particular couple on the video had suffered with PTSD, both of them, for a very traumatic birth experience, a sad loss of their first baby, their first pregnancy. So this is their second pregnancy, and it's just highlighting the difference continuity of care can make, and we couldn't have provided that continuity of care service without our new layer of developing Band 4s. Very quickly, because it's a bit controversial, they are studying the nursing associate qualification, which will give them a foundation degree, and added to that, they have done a maternity module of the midwifery degree at our local university, University of West of England, who have also been looking, if any of you are aware, for maternity support workers. UE were the university who were worked with to be able to look at roles and responsibilities and the progression routes for maternity support workers, and making it a clearer pathway. And if we look at Band 4s, it's about them having a foundation degree. So we're sort of being a bit innovative and ticked that box because there wasn't a maternity foundation degree available. So I'm going to change screens to be able to plug in whilst Sally Ann's going to turn a little bit
So whilst Liz does this, I don't make any apologies for the speed dating style we're using. We thought we were going to be last, and we wanted to keep you all awake by having lots of us up here. So, you know, this is our strategy, but we're not last anymore, so that's great. So, you know, I will say it has been a really hard journey, a roller coaster, lots of challenges. Although it's a 2-year ago inception, actually we didn't have a full team until probably last September. So if you look at the time frame, we're 15 months into it, as with many of us, and actually that journey is still going, and we're just reaching momentum now. So I think you know, it's really important to put that into context of where we are. Long way to go, but next steps. What are our next steps? Getting the paper light rolled out, absolutely crucial. We're really excited. We're starting some go lives now at the Taunton site, and hopefully Yeovil will be coming on board early next year. We've got a single point of access that we're growing on. Trial of continuity of carer pilots. Now Somerset's going through some huge changes at the moment. So as a county, lots of alliances are going on. So there are acute trusts merging with primary care, which opens lots of doors, literally lots of doors, to lots of buildings with some empty rooms that we want to utilise. And so we want to do continuity of carer teams and trials within some of those neighbourhood settings. And that's alongside a joint antenatal offer with our health visiting colleagues, because as, again, with lots of other of the organisations, antenatal services in Somerset are now 2Ping over to County Council, which brings a whole level of different challenges. We've got Get Set going for the 0 to 4s. So lots of things going along our way. So we really wanted to trial our continuity of care models. Hopefully identified 2 areas, might be a third now because I've just been talking to Helen, and we might have a mid-county one where both acute trusts look at a continuity of care model around the middle of the county where we cross over. So some fantastic work that we're going to be doing there. As I say, the development of the hubs will be joint with health visitors and other services. It was great to hear about things like citizens' advice going in. I think they're really great opportunities. There's a lot about workforce redesign with our use of our Band 4s, and how, you know, it's not about, I think what's really crucial, this isn't about eroding midwives' jobs. It absolutely isn't about eroding midwives' jobs. It's about putting another layer of care in to actually enable and support the provision of better care for our ladies. I'm not going to talk anymore because, MVP very quickly, I saw Lisa here and she is my guru. I think she's wonderful and I want to claim her for every MVP. We're just out and interviewing now, aren't we? So hopefully we'll have a really active MVP that can help us carry forward.
So this is our story of our amazing couple who filmed this for us, and he previously done